collaboration between the U.S. Department of Veteran Affairs, VA Center for Faith-Based and Neighborhood Partnerships, CFBNP, and the Veterans Health Administration Homeless Program Office. My name is Trulesta Pauling. I will be your moderator this afternoon. Everyone's phone has been muted. If you have a question during the presentation today, please type it in the Q&A box on the right of your screen. I will read the questions at the end of the presentation, and the presenter will provide a response. The presentation will be sent to everyone that registered and joined this webinar today. This is a live recording. I would like to thank Mr. Shawn for this collaboration. We are grateful for your time today. But before we get started, I would like to introduce Mr. Conrad Washington, Director of the VA Center for Faith-Based and Neighborhood Partnership. Mr. Washington is a retired combat Marine with 20 years of active duty service. He is a licensed minister, actively serving in his faith. He received his Master's of Divinity in Pastoral Studies from Moody Theological Seminary, Master's in Business Management, and a Bachelor of Science degree in Education. Additionally, he is a graduate of VA Class of 2017 Virtual Aspiring Leaders Program. Mr. Washington?
Hey, thank you, True. I appreciate it. And thank you all for joining us today. We're glad that you stopped by the VA, specifically the Center for Faith-Based and Neighborhood Partnerships. I want to give a special shout out to Shawn for joining us today as a subject matter expert for veteran homelessness. I'm not going to try to even attempt to steal his thunder because I can't. He's the subject matter expert. But I will share with you that like many initiatives and many different programs in the VA, we cannot do it without you. And Shawn is going to share with you so many different programs within this specific initiative that is important, that allows you, the attendee for today, to reach out as a community and help us that we may work together to help our veterans because we need you. And I keep saying that. So please pay attention. I thank you again for joining us, and to all of you, be blessed.
Thank you, Mr. Washington. At this time, I would like to introduce our presenter for today, Mr. Shawn Liu. Please read a summary of his bio on the screen. Mr. Liu is the Director of Communications for the VHA Homeless Program Office. He is responsible for developing strategic communications that enhance efforts to end and to prevent homelessness amongst veterans and their families. His office hosts a monthly podcast, Ending Veteran Homelessness, that it offers a look into VA nationwide efforts to help veterans experiencing and at risk of homelessness. Mr. Liu also supports the development and implementation of national policies, plans, guidelines, and technical assistance for a variety of VA homeless programs and initiatives. This summer marks Mr. Liu's 16-year working here at the VA. He holds a Bachelor of Arts in Psychology degree from Florida International University and a Master of Social Work degree from Florida State University. He is a licensed clinical social worker with the state of Florida. At this time, I give you today's speaker, Mr. Shawn Liu.
Great, thanks so much.
Shawn?
Thanks so much, Ms. Pauling. Hello, everybody. It's great to be here with you today to talk about a really important topic, veteran homelessness. I'm going to go ahead and take off my camera to save on bandwidth, and we'll go ahead and dive on in. You saw a really important intro in that video just a while ago, giving a progress update. I'm going to expand upon that a little bit, but also share with you a variety of initiatives, programs, and services that we have in this important work. All right. So here's the agenda for the remaining time that I have with you today. I'm going to go over some introductory concepts just so we can level set on what we're talking about when we say veteran homelessness. I'm going to give you a progress update on how we're doing. Going to talk to you about our recent homelessness goals, talk about the different assistance resources, and ways in which you can help and stay engaged. All right, let's go on to the next slide. Okay, some introductory concepts to level set. What do we mean when we say homeless veteran? So I want to start with the word homeless for a second. When we think about the experience of homelessness, for our purposes at VA, we're largely taking this information from statute. This particular language is from something called the Hearth Act of 2009. It was a major piece of legislation that provided homeless services for people all across the country in America, and it further defined the definition of what we mean when we say homeless. In homelessness, if you're going to be homeless for the purposes of program eligibility for VA homeless programs and services, you would be one of these 4 categories. Category 1 is something that you probably feel is pretty intuitive. Folks who lack a fixed, regular, adequate nighttime residence, and these are going to be in settings such as emergency shelters, transitional housing programs. During the pandemic, we made a really great use of hotels and motels as emergency shelter. But this also includes places not meant for human habitation. So think literally on the streets, literally in the woods, in encampment, under bridges. We also called this unsheltered homelessness as well. So category 1 fits in the general description of homelessness that you probably are intuitively familiar with. Category 2 focuses on those who will imminently lose their primary nighttime residence, usually within 14 days, and but for some type of assistance, will become that category 1 homeless in the future. Category 3 has a lot of implications for families with minor children or youth under the age of 25, which basically says if there are other federal statutes that govern the definition of homelessness for youth under 25 years of age or family with minor children or youth in their household, that you also qualify for the purposes of our programs and services. A lot of times what we're also talking about is the experience of couch surfing or doubled up, where a youth or a family with minor children may be moving regularly. So maybe they spend 2 nights with their auntie and then 4 nights with their mom's sister and then 5 nights over here with a family friend, and they're moving and moving and moving. That disruption, that chaos is very, very detrimental to minor children and youth under the age of 25. So these folks, if that's their experience, are also included. And the last category, category 4, is those fleeing domestic violence or other life-threatening circumstances. This has really important implications for women veterans, especially as women experiencing homelessness often experience their homelessness in that doubled up or couch surfing ways, and occasionally due to fleeing domestic violence or some other life-threatening circumstance. All right. These 4 categories are what we mean when we say homelessness for the purposes of VA program eligibility. Next, I want to talk about the definition of veteran. Now, this veteran definition is broad. It is very broad. It's broader than VHA healthcare eligibility. It's broader than the eligibility for the specific VA homeless programs. And it's meant to be broad because it speaks to the need for a community response of really helping any person who's worn the uniform of our country. And so this definition, when we talk about the work to end veteran homelessness, we're talking about adults who've served active duty in the United States Armed Forces, including those who've served in active duty from the reserves or the National Guard, regardless of how long they've served or the type of discharge they've received, which really speaks to all of us as a country, and maybe more narrowly for us in homeless services, that even if a veteran isn't eligible for VA homeless programs and services, even if a veteran isn't eligible for VA healthcare, that as a country, we'll still need to find responses and solutions to address their homelessness. You might be wondering, and you may have wondered, well, Shawn, why do veterans become homeless? Like, is it the drugs? Is it the alcohol? Like, what's the deal? And I want to kind of acknowledge that when we think about risk factors for why a veteran may become homeless, we need to separate them into 2 different categories or 2 different types of factors: individual factors and system level or structural factors. The individual level factors are ones that you probably feel are pretty intuitive. You're probably familiar with, right? So these are going to be things such as, yes, mental illness, substance use disorder, substance addiction, but also things like lack of stable income or employment, history of incarceration. For men in particular, single men, history of incarceration is one of the most strongest predictors of future homelessness. But also lack of social support and adverse childhood events, which may be a little bit counterintuitive since these childhood events are things that happen before military service. Now, the individual factors are also mediated and they interact with system level or structural factors. This is just fancy speak for things in the environment, in the neighborhood, in the community that might impact of the people there living, whether or not their risk of homelessness increases. And these are going to be things that you may not immediately think about when it comes to homelessness, but the more I talk about it, hopefully the more sensible they sound. So things like lack of affordable housing. Are there rental units and homes that people can afford with the income that they have? Lack of economic opportunities. So whether or not a person has the job skills or the job experience, are there good paying jobs in their communities? And other things such as high crime neighborhoods and cultural factors. What I hope that you take away from here is that a veteran becoming homeless it's not just one thing or two things. It's not the PTSD, or it's not the drugs. It's a mix of these individual factors and system level factors. As an aside, when it comes to VA and our service providers, our partners, and the work to not only address veteran homelessness, but prevent it from happening in the first place, a lot of this means addressing and taking care of all of these different risk factors, reducing the impact that they can have on individual veterans and on communities. All right. I want to shift gears now and talk about the progress towards ending veteran homelessness. You heard some of the progress already in that wonderful video that opened up today's webinar, but I'm going to unpack some of that data a little bit more, get into a little bit more specifics. Now, when we think about the benchmark, the metric that we use to evaluate whether or not we're making progress towards veteran homelessness, and I would also say homelessness across America, the main metric or the main data source that we use is something called the point in time count. It's put on by our partners at the U.S. Department of Housing and Urban Development. It's kind of like a form of a homeless census. It happens every year, usually in the coldest night of the year, end of January. And it's meant to be a survey and an account of everybody who's experiencing homelessness in America, including veterans. And it provides the year-over-year benchmark of how we're doing. The slide that you see here in this chart is basically the number of veterans counted each year at that point in time count from 2010 up until the most recent count that we have data for, which is 2023. And what you can see here, basically what was said on that video, is that overall, since 2010, there's a 52% reduction in veteran homelessness. This is huge and somewhat unprecedented in the history of our country. If you recall earlier when I was doing the level setting with the introductory concepts, I also mentioned how that category 1 homelessness is usually broken out into shelter homelessness and unsheltered homelessness. Well, that's reflected here. The bright red line is overall homelessness among veterans. The dark red or maroon line is sheltered homelessness, and the dark blue line is unsheltered homelessness. And what you can kind of see here is that a lot of the improvements in veteran homelessness has been with veterans who've been sheltered, but we've seen some stagnation with the veterans who've experienced unsheltered homelessness. This is something that's concerning to us. The experience of unsheltered homelessness is one of the most dangerous experiences that a person can face. And so it's up to us at VA and our community partners and all of us to make sure that we're bringing not only veterans, but all Americans in from the elements into sheltered situations and getting them on that path to housing. In the next few slides, I'm going to unpack this point in time count data a little bit more to contextualize this reduction that you're seeing. The next slide is looking at women veterans, right? There's this concept in equity. There's this concept in the world today of what's called disaggregating your data. And that's just another fancy jargony speak for when you look at your data and you have different subpopulations that data represents. Take a look at how it's working for those subpopulations and making sure that any of the progress that you're making is being realized by all veterans. So what you're actually looking at is the point in time count for women veterans specifically. Now, a couple of things. We actually don't have women gendered data going back to 2010. We only have gendered data going back to 2014. So it's not yet an apples to apples comparison. But similarly, with women veterans, the 3 lines you have, the purple line is all women veterans. The kind of like hot pink red line is sheltered women veterans, and the blue line is unsheltered veterans. And you can kind of see here that even though veteran homelessness among women veterans has decreased by 14%, it's predominantly by women veterans experiencing sheltered homelessness. And unfortunately, women veterans who've experienced unsheltered homelessness, that's on the rise. That's very, very alarming. I'm going to do one more slide to contextualize what we're seeing here. Now, what I've done is I've taken the red line from the PIT count and just looked at 2014 to 2023 and taken the purple line from the last slide so you can compare. So again, I know there's a lot of visuals and charts and numbers. I hope you're hanging in with me. Again, the red line now is all veterans from 2014 to 2023. The purple line is women veterans from 2014 to 2023. Although veteran homelessness has decreased by 27% since 2014, it's only decreased by a little more than 14% for women veterans. Now, this is something that's important for us at VA. If we're going to truly end veteran homelessness, we need to end it for all veterans. And one of the things that we're doing is not only looking at this data by gender, but also by race, rurality, other demographics, because it's important to us to make sure that the progress that we're seeing is being seen by all veterans. Also, to put this into context, right? I mentioned that not only is the decline, the 52% decline, it's kind of unprecedented. It's also in context, it's a decline where other subpopulations of people experiencing homelessness and homelessness overall in our country has been stagnating or going or increasing, has been on the rise. So this green line that you're seeing right here is actually homelessness for all homeless people, not just veterans, but all homeless people. And what you can see is that it's actually increased by nearly 3% since 2010, despite the fact that veteran homelessness has decreased since 2010. So what you may be asking is what's going right with the veteran space? I'm going to share that in a little bit, talk about the programs and services that are available for veterans. All right, this next slide here, it's a little bit squished, so I apologize here, but the one last thing to contextualize the data that you're seeing is that if you notice with the red line, the progress shallows out a little bit. There's a steep decline from 2010 to 2016, and then there's still a decline from 2016 to 2023, but it's shallower. One of the contexts here is that, and you know this from probably just living your lives on a day-to-day basis, housing costs have been increasing pretty steadily. The new purple line that you're seeing here is the average fair market rent value for one-bedroom units based off of the Department of Housing and Urban Development. And you can see that the shallowing out in veteran homelessness decreasing, it coincides with a steadily and then dramatic increase in the rental costs. This kind of has really, really important implications, not only the work that's done, but signals the importance of developing good, affordable housing, as well as making sure that our veterans have access to that affordable housing. All right. I say the term ending veteran homelessness a lot. VA even lets me have a podcast, and the podcast is called Ending Veteran Homelessness. I say it so much, it's almost like a tick now. So it's probably helpful for me to define what on earth I mean when I say ending veteran homelessness. And to be clear, we're not saying that no veteran will experience a housing crisis again. Crises are inevitably going to happen. But the vision of the world that we're working towards is that when we have an end to homelessness, it means no one experiences the tragedy and indignity of homelessness, and that everyone, every veteran, has a safe, stable, accessible, and affordable home. This milestone, this world that we are working towards is a virtuous one. It's an important one. It will be hard to get there. And I will say it's going to be even harder to sustain it. So that's why good partnership with folks like you joining us on all this mission and constant vigilance is going to be critical. Just as an aside, we at the federal government, we've actually operationalized what we mean when we say ending veteran homelessness. It's a technical term that we call the criteria and benchmarks for achieving the goal of ending veteran homelessness. You can tell it's a government thing because the title is so long, but it describes how your communities should look, both in terms of the resources that you have, the way that your resources work together, the response that you have, that actually not only continues to reduce the number of veterans who are experiencing homelessness, but that you're able to quickly and rapidly house and rehouse veterans who do fall into homelessness, and that your communities are able to document all of this through good, robust data. If this seems lofty to you, I want to give you hope. This isn't pie in the sky. This is actually stuff that is working. 83 communities, including 3 whole states, Virginia, Connecticut, and Delaware, have achieved an effective end to veteran homelessness. This picture of the country, each star represents a community that has actually achieved the end to veteran homelessness. But we still have more work to do. This is not every community in the country, so the mission continues. All right, I want to shift gears again and just focus on, show you a little bit about what our focus is this coming fiscal year. This is our fiscal year 2024 homelessness goals. So a little bit of background. If you remember on those pit count slides, I mentioned that the decline in veteran homelessness isn't even. There was a lot of progress from 2010 to 2016, and then it kind of shallowed out from 2016 to 2023. We at VA, we found that alarming. We actually thought it was so alarming, we gave it a name. We called it the stall, that progress had stalled. So to help revitalize and double down on our work, for the past 2 calendar years, Secretary McDonough had challenged us at VA to permanently house 38,000 homeless veterans back to back. House 38,000 homeless veterans in 2022, house another 38,000 homeless veterans in 2023. To put into context, just to kind of visualize what this represents, 38,000 is about the number of seats at Fenway Park. So think 2 Fenway Parks, and that's a number of veterans that the Secretary challenged us to house. And he challenged us not to just put them into temporary housing or emergency shelters, to permanently house them. And that means getting into apartments or houses that veterans could rent or own, oftentimes with subsidies that make it affordable for them. We at VA, not only did we meet those goals, we dramatically exceeded it. In 2022, we housed 40,401 homeless veterans. And then in 2023, we housed 46,552 veterans. Over the last 2 years, we've housed nearly 87,000 homeless veterans, which is really, really important work and is a way to double down on the effort. But we're not going to stop there. We're keeping on housing homeless veterans. And so this gets us to this fiscal year's homelessness goals. So in 2024, in fiscal year 2024, VA has a goal. We've actually increased the goal. Instead of 38,000, our goal is to house 41,000 homeless veterans. As of March, we are on target. 22,500 veterans have been permanently housed, representing a little over half of the goal. We also have a couple components as well to our goals. Sometimes, just with substance addiction, relapse is a part of recovery. With housing and addressing homelessness, relapse is sometimes a part of recovery too. And that relapse can take the form of falling back into homelessness after recently becoming housed. That's pretty alarming. You probably didn't anticipate me saying that, but that's pretty alarming. And because that's alarming, we also have our second goal for this fiscal year is that of the veterans that we house this year, 95% of them will stay housed by the end of the year. As of March, 98.2% of the veterans we've housed have remained in housing. Only 414 veterans have returned to homelessness, representing about 1.8% of the veterans that we've housed. We're actually working to re-engage those veterans, find them again, get them enrolled again, get them back into our system of care. And you've heard me talk a lot already about unsheltered homelessness. And so we have a goal to engage with at least 40,000 unsheltered veterans. As of March, we've already engaged with 21,000 unsheltered veterans, representing about 53% of the goal. We're anticipating meeting all of these goals, but just because we meet them doesn't mean we're going to stop. We're going to keep going, keep housing homeless veterans, keep engaging with unsheltered veterans, and making sure that they stay housed. Now, the thing that you're probably been waiting for, we're going to talk a little bit about the tools in the toolkit, the homelessness assistance resources that we have at our disposal. Now, the list is long, and not this slide, but in the next slide, I'm going to go through the list. Because the list is long and the programs are kind of technical, I'm not going to go program by program by program and go through that. That would take too long. What I'm going to do is just talk to you about the types of interventions, the intervention points that the programs and services seek to address. And you're going to get these slides after. They'll have hyperlinks so that you can learn more about the different programs. You can just click on the link when you get the slides and you'll be able to check it out. At VA, with us and our community partners, we have programs and services that address a broad range of housing instability and homelessness needs that a veteran may face. And this often starts with prevention services. So keeping veterans in their own homes and in their apartments so that they don't have to touch the system in the first place. In the unfortunate event that a veteran may become homeless, we have outreach, engagement, assessment, and referral services. These serve as the front door to VA, not only our homeless programs, but all of the VA benefits and services. Often this happens in other emergency shelters, in encampments, but I want to let you know, we have outreach that actually goes to jails and prisons. I mentioned a little bit earlier that a history of incarceration is one of the strongest predictive factors for especially for male veterans. So we actually go into jails and prisons and outreach those veterans so that they get connected to VA upon release. We have residential services that provide temporary places for veterans to stay right now so they can get out of the elements. And then ultimately permanent housing services that provide, again, get veterans into fair market value apartments or their own homes, oftentimes with subsidies that make rent affordable, and all of the wraparound services like counseling, case management, primary care that will keep them in their homes as well. This is the alphabet soup list. I've crosswalked all of the different programs that we have to those categories that I mentioned. So when you get these slides, you'll be able to click on it if you want to learn more. In addition to those interventions, I want to let you know that VA has even more types of services to help veterans with their different needs. We have a homeless veteran community employment services to help get veterans connected to employment, that whether they're disabled or whether their job, ready and interested in work, we can help veterans get actually meaningful employment. We have primary care, medical doctors that provide services that are tailored to the unique barriers that homeless veterans face when accessing primary care, and even legal services that provide veterans with assistance with taking care of legal issues that may be barriers to housing. A wide array of services that are all here. Some of you may be familiar with these, with this alphabet soup slide. Some of you may be familiar with the terms. All the links are here for you to click on. All right. We're going to leave some time at the end for Q&A, but before I turn it over to Q&A, I just want to provide a couple opportunities of how you can partner with us in this particular work. If you encounter a veteran experiencing homelessness right in front of you in person, the number one thing to do, be patient. Be patient with them. Want to acknowledge they may not have had their basic needs met. What do I mean by that? They probably didn't sleep good last night. They may or may not have eaten anything yet. They may be dehydrated, right? And so being patient is really, really, really critical. Understand, like if you're trying to help out in terms of outreach and getting them connected to us, they may not have a reliable means of communication. They may not have a phone. They probably don't have a physical address to provide. So we want to work together to make sure that we can keep that line of communication open and so that we can follow up with that veteran. And of course, hope is critically important. You want to instill hope, but never almost overpromise. One of the things that our outreach staff do is work to build trust and build relationships. And a lot of times that trust can be broken whenever promises are made, but promises aren't kept, right? So we want to instill hope, but never overpromise. You're going to get a copy of these slides, but on the off chance that you just want to kind of get to them now, there's a QR code here that if you want to open up your phone, you can click. It's actually going to take you to a link. It's our resource link. In the next few slides, I've got a bunch of hyperlinks and a couple other things that are a little bit cumbersome in this space. So if you want to use the QR code to access it, you can actually get it from your smartphone right now. All right, I'm going to go on to the next slide. If you want to know more, if you want to connect to your local VA to find out what opportunities, what needs there are, shoot us an email, homelessvets@va.gov. We'll get you connected to your local VA, especially if you want to collaborate, you want to look for volunteer opportunities. Maybe you have jobs and you want to hire veterans. Reach out to us. We'll get you connected to your local VA. Keep this number handy. It's the National Call Center for Homeless Veterans, 877-424-3838. This is the best way to get veterans connected to VA. No phone trees, no kind of navigating the halls. They'll get them connected to their nearest VA. Keep this number handy on you. If you meet a veteran in person, help them get to this number so they can call us so we can get them the help that they need. It's available 24 hours a day, 7 days a week. Some of you may be in a position to make donations, do different drives, otherwise donate or contribute. There are a lot of important opportunities from training to furniture to transportation to housing assistance and more. We partner really well with VA Center for Development and Civic Engagement to make that happen. The link here will help you get connected to your Center for Development and Civic Engagement, your local VA, for any volunteer or donation opportunities. We have stand downs. Stand downs are really, really important, meaningful, and dare I say fun events, typically 1 to 3 day events. You're familiar with job fairs? Stand downs are like resource fairs where people experiencing homelessness, predominantly veterans, can come and get access to a whole bunch of different resources, donations, food, get connected to services. We run these stand downs through volunteers. There may be a stand down. I bet you there's a stand down in your community coming up. We have the link to the upcoming stand down events page that you can check out. check it out pretty regularly because we keep on adding new events all throughout the year. If you're a landlord, property owner, property owners, rent to our veterans. All of the work that I've talked about, the progress, the programs and services, VA doesn't have the ability to build our own apartments for veterans. We rely on affordable housing in your communities. And so we need good landlords who will rent to veterans on an affordable basis. You can visit our landlords page to learn more and actually even submit any rental units that you might have. Maybe you're not a landlord, but you still want to get involved in housing homeless veterans. Maybe you have aspirations to be a service provider. Maybe you want to provide some of those residential treatment programs. Maybe you're a nonprofit. We actually have a really helpful article. It's called So You Want to House Homeless Veterans. It goes through our major homeless programs and provides the initial steps if you want to be a provider for one of those programs. So I encourage you to check it out. If you're a business owner, hire our veterans. Many of our veterans are disabled, but even if they're disabled, there's a concept in our world called income maximization, which is basically working within the constraints and guidelines of their disability benefits to figure out ways to augment and thus maximize their income, pushing the limits and making sure that they can live full, robust lives. But even despite or outside of the veterans who are disabled who might be maximizing their income, we have a lot of other veterans who employment is the way that they will achieve financial stability. And so if you have jobs, we want to connect with you. There's a link here to our community employment coordinator page. We have community employment coordinators all across the country whose job it is to create a robust array of employment resources and help get veterans connected to jobs. So we want to connect with you. Last, before I turn it over for Q&A, just a couple different ways for you to stay connected to and engaged. If you want, sign up for our newsletter. It's a monthly newsletter that provides a lot of different good news stories, updates from our executive director, notices about grants. If you want to sign up, just visit us online, www.va.gov/homeless. When you go there, a little window will pop up saying, hey, you want to subscribe? Type in your email and you're on your way. Lastly, check out our podcast. I mentioned it earlier. It's called Ending Veteran Homelessness. It's meant to provide a demystified look at all of the technical, the jargon, the whatnot. If you want to stay connected on the latest and greatest on how we're doing with veteran homelessness, and you want to learn more and ease your way into the technical stuff, subscribe. It's available on your preferred platform, Apple Podcasts, Spotify, Audible, your podcatcher of choice. All right. That is all for me. I really appreciate the time. I look forward to your questions. Thank you so much for the day. I hope they found this valuable and that you feel empowered in our collective work to ensure that every veteran has a safe and stable place to call home. Thanks.
Thank you, Shawn, for that presentation. We have about 8 questions we'll try to get through to. Now we're going to address those questions. I'll read the questions out loud and Mr. Liu will provide a response. If we are unable to get around to everyone's questions today, we have the questions, and your email addresses, we will get back to you with the response. Okay, first question comes from Daryl Brown, and his question is, Shawn, how do the percentage convert into numbers? Speaking in percentage does not provide a clear picture of how many people. Showing percentage and numbers provide a clear picture.
Yeah, absolutely. I'm also going to put on my camera for this because I think we're good. When we talk about the 52% decline in veteran homelessness since 2010, what we're largely talking about a high of around, I don't have the number exactly handy, but around 74,000 veterans. And then all the way down to 2023, which was about 35,000, 36,000 homeless veterans. And on that chart that you have, it actually has the numeric breakdown of overall homelessness year over year, and then sheltered and unsheltered. And then if you want, you can actually bust out your calculator and do any percent changes based off of any type of date range that you want. But yeah, it is in the slides. We'll go ahead and we'll make sure that you get that. And yeah, you'll be able to check it out directly.
Thank you. Question 2 comes from Jason Denny. Also, do you have the charts/graphs for Texas along for Austin?
That's a great question. So the information that I showed is publicly available, and Ms. Pauling, in the follow-up we can provide, I'll get the link to where that information is available. It's on the U.S. Department of Housing and Urban Development's website. And again, we'll provide you with a link to that. They have spreadsheets that break this information down by state, which you can check out Texas and it'll show you the different years. And then also by something called continuum of care, which is another jargon for like a geographic catchment area. There's around 400 different continuum of care regions in the country. Austin is part of a broader one, and you'll be able to access those. They're publicly available, but we'll make sure to get the link.
Thank you, Shawn, and we'll get that to you, Mr. Denny. The next three questions come from Daryl Brown again. Question 3, how much of the decrease in homeless veterans is impacted by the number of veterans passing away? The more who die who are homeless would impact the numbers.
Yeah, that's a really great question. And I don't have the research off the top of my head. I am familiar with some research that has looked at the work to end veteran homelessness in the context of this very question, which is if there are fewer veterans overall, and all things being equal, does that mean just fewer veterans? And in truth, some of the progress is simply just a one-to-one correlation of there are fewer veterans overall in America. And so if the rates hold the same, then there are fewer veterans experiencing homelessness. But what we can also say is that a decent percentage of the progress is actually due to what we call permanent housing placements, which is fancy jargon for us actually moving veterans into the street. And so we're able to kind of see and compare the decline based off of how many permanent housing placements that we do and some of the other kind of service activity. So I don't have the exact proportions of how much percentage it is. It is true that some of that is explained by there's just fewer homeless veterans, but a big portion of that is through the immense amount of resources, the hard work, the billions of dollars that have been invested too. And what I would argue is that we can kind of see the evidence of that in the decrease in veteran homelessness, while other subpopulations in general homelessness is actually increased.
Thank you. Question 4 again from Mr. Brown. What is considered affordable housing rent by region and state?
That's a really great question and a complicated one that I will not provide a meaningful response to. Historically, the concept of affordable housing was, based off of what a person's income is. So that if you were paying anywhere from 30 to 40% of your income, depending on what costs you include. Oftentimes, if you think about it, it's like 40% of your income to include rent and utilities like water and sewer and electricity, that would be affordable. And that any other percentage higher than 40% of what you actually pay of your money towards housing would be unaffordable. But you can see here how that's actually a reflection not of the world, but of the people living in a community and whether or not their housing costs are affordable for their unique needs. I'm not going to provide you a meaningful response to it because it also varies widely. There's a lot of evolving language about that. But generally speaking, historically, we've thought of affordable housing as what percentage of your income are you able to pay or do you have to pay in order to live in particular units?
Thank you, Shawn. And question 5 from Mr. Brown. Is there data/information to show how many homeless veterans are in Alaska, specifically in Southeast Alaska?
Yep. So the same as the question before about Texas, that public-facing site from the U.S. Department of Housing and Urban Development has the data by state. I'm going to be honest, I don't know how they subdivide Alaska because Alaska may only have like 1 or 2 different regions. So I don't know if it's actually going to get as specific as Southeast Alaska. But that public-facing website will connect you. You'll be able to search by state and the different regions within a state.
Thank you. Question 6 is coming from Ms. Donna Harrison. Her question is, since incarceration is a strong predictive factor for homelessness, will the VA continue to work to increase VA veteran justice outreach /HCRV positions, which help connect justice-involved veterans to homeless services and other resources?
Yep, absolutely. Great question. And the short answer is yes. The long answer is, I can't speak on to resource allocations year over year, but yes, generally speaking, we're looking to increase both the presence and the reach for justice involved veterans. And a lot of that times means making sure that we are expanding our justice programs, making sure there's good coverage to all of our jails, prisons. We also cover diversionary courts, which is important as well. So you think drug court, veteran court, which help divert veterans from the traditional court process. And then we're also, I just mentioned, we're focusing a lot on partnerships these days, especially helping to create partnerships with law enforcement and other first responders so that we're able to work with veterans before they even interact with the legal system altogether. So it's not just positions, it's also very, very important partnerships with law enforcement and first responders.
Thank you, Shawn. Question 7 is also coming from Ms. Harriston, and her question is also, will the VA be pushing out more marketing for jails and prisons to sign on to the VA system VRSS so criminal justice partners can more accurately identify veterans?
Yeah, absolutely. So that's something that we are working on. I was actually part of a project last year to create marketing materials for VRSS. And so many of those materials are made. And so what we're doing now is utilizing them to get the word out. But no, for those who are not familiar, VRSS is a wonderful web-based tool. It's called Veteran Reentry Search Service. It is a free tool available to criminal justice institutions. And what it does is it helps readily and speedily criminal justice institutions to speedily identify the veterans in their populations so they can identify not only who's a veteran, but it also flags them and notifies VA so that we can go out and connect to them. It's a free, amazing tool. We want to get the word out. Ms. Pauling, I'll make sure that you get the website to that as well so we can include it in the follow-up.
Okay, thank you so much. We appreciate that. Next question is coming from Ralph Duarte. Does the VA have the ability to house unsheltered homeless veterans the same day?
Yeah, this is a great question. And this is largely going to depend on the community. If you've heard the joke, you've been to one VA, you've been to one VA, this is apparent. What I can tell you is that we are striving, especially for our residential programs, for same day access. And what that means is that for veterans who are unsheltered, who are out in the streets, when they meet with an outreach worker, that we want to get them into some kind of temporary setting that day. That has been a journey. We've been providing a lot of guidance, training, technical assistance, policy updates around that. It's a work in progress, but that's something that I hope that as time goes on, that we're going to get better at. When it comes to providing permanent housing same day, that's a bigger challenge that we are still striving for, reducing the amount of time it takes for veterans to get permanently housed. There are a couple other factors. A big one is the affordable housing availability in a community, but these are the amount of time it takes to get veterans into these resources is something that is a very high priority for us, and we're working on very diligently to improve.
Thank you. Question 9 is coming from Lillian Rodriguez. Do you have a housing list of available units by landlords in Massachusetts, and how can I access?
So not in the ways that you're asking. However, if there is some other need, especially if you're a service provider and you want to partner with us, shoot us an email, homelessvets@va.gov, and we will try to connect you to the local resources and work on that. But yeah, I know what you're asking. It's not the available units is not in the way that you're hoping for.
Thank you so much. And looks like this is the last question from Lindsay Dirks. Is there information on how public assistance programs affect the overall number of veterans who are homeless?
That's a really interesting question. And I'm just going to assume that you're talking about non-veteran specific public assistance, like things like food stamps, LIHEAP, other mainstream benefits. I am actually not familiar with research. Not saying it doesn't exist, but I'm not familiar with research on this particular topic. One of the things that I also want to just mention to provide at least some type of meaningful response to you is that a reminder that veterans are, this is weird to say, veterans are citizens too, they're Americans. And what I mean by that is that so often in veteran services, there is a hyperfixation on veteran specific this. And that veteran specific this thing has definitely contributed to the 52% reduction in veteran homelessness. But because we get often so fixated in providing a veterans specific version of a resource, we forget that veterans are also eligible for other things too, like mainstream benefits like food stamps, Medicare, Medicaid, all of those other things too. And I just kind of want to, I know that's not a direct answer to your question, but for those who might be in a position who may be making referrals, remember that veterans are not just eligible for the stuff for veterans, they're also eligible for all the other stuff that maybe like me as a civilian will be eligible to. It's a really, really great question. I haven't seen research on it, but it's an important topic to remember, especially from an operational standpoint.
Thank you. Thank you so much, Mr. Liu, for the excellent presentation. So knowledgeable and updated as always. We certainly appreciate you and support. And thank you for doing this webinar today. If you need to reach out to the presenter, Mr. Shawn Liu, please see his point of contact information on the screen. As he said, you can scan the QR code to go directly to his office. You can also reach out to our team for any information as well. Our point of contact information is on the screen now as well. At this time, I'm going to turn the mic back over to Mr. Washington, who will provide some closing remarks.
Thanks, Joe. I just want to thank all of you for joining us. Thank you, Shawn. Appreciate you. As usual, you provided great information. We look forward to you all joining us again. So take care and be blessed.
Thank you, Mr. Washington. If you registered for this event, we will provide you with today's presentation. A recording of this webinar will be provided on our website at a later date. Please subscribe to our website and Facebook for future webinars and information. This adjourns today's webinar. Thank you so much for joining us today. Have a good day and goodbye.